Welcome to everyone.
Hi, I'm Grace Lilly. I'm studying MSc Nursing second year. I'm from Government College of Nursing. As part of my research study, I'm sharing knowledge regarding monkeypox disease.
An environment is everything that is around us, which includes both living and non living things such as soil, water, animals, and plants, which adapt themselves to their surroundings. It is God's gift that helps in nourishing life on earth. The flora, fauna, and microorganisms, as well as the man made structures in our surroundings, have a bidirectional interaction with us directly or indirectly. Here we can see all the flora around us. Our environment includes birds, insects, and all kinds of animals, water animals, terrestrial animals, and all kinds of insects. Our environment includes all kinds of microorganisms such as bacteria, viruses, and fungi. In this session, we are going to learn about one particular virus and the disease it causes. Objectives. General objectives. By the end of video assisted teaching, the students will gain knowledge on monkeypox. Specific objectives. In this session, we are going to learn about introduction to monkeypox virus, definition, epidemiology, incidence, modes of transmission, pathophysiology, signs and symptoms, diagnostic evaluation, complications, treatment or management, nursing management, prevention. Monkeypox disease. Are you all ready to learn about monkeypox? Introduction. First, we will see what is a virus. A virus is a submicroscopic infectious agent that replicates only inside the living cells of an organism. So, as we all know, a virus cannot live outside an organism. It needs a cell, living cell, in order to replicate, and it causes the infection and disease to the host. Viruses infect all life forms from animals and plants to microorganisms, including bacteria and archaea. So, viruses can even infect not only animals and plants but also bacteria and archaea. Monkeypox is an illness caused by the monkeypox virus. It is a viral zoonotic infection. Here, the word zoonotic means the disease can spread from animals to humans. Here we can see the virus transmission. So first the virus has transmitted from animals to humans. Here the virus usually is carried in monkeys. So monkeys act as an animal reservoir, and the transmission from the animals to the human is called zoonotic transmission. After transmission to humans, the virus can transmit from human to human, and it can result in an outbreak. So that is called human to human transmission. Usually this virus is of two types, clade 1 and clade 2. In about these we will see in further slides. Here we can see the manifestation of monkeypox virus on skin in human beings. We can see this blister-like structures, and they are deeply seated inside the skin. Monkeypox virus is an enveloped double-stranded DNA virus that belongs to the orthopox virus genus of the Poxviridae family, that is smallpox virus family. So monkeypox virus belongs to the genus called orthopox virus genus and family called Poxviridae family, and it is as the same of smallpox virus family. And it is also a double-stranded DNA virus which is enveloped. Now we will see the structure of monkeypox virus. First we can see the outer layer, that is outer membrane. The next lining is inner membrane, and this flat body is called lateral body. Then core wall. These are the surface proteins. Then comes the nucleocapsid, which surrounds the double helical DNA structure. The core. These are the viral enzymes. This is the palisade layer next to the core wall. This is the core membrane. These are the parts of the monkeypox virus. Now we'll see the brief history of monkeypox virus. The monkeypox virus was first discovered in 1958 at Denmark. So this virus was first found in the monkeys which were kept for research purpose. So they are called rhesus monkeys. So the virus was not discovered in humans, but it was discovered in animals, that is a group of rhesus monkeys which are kept for research in 1958 at Denmark. The first human case of monkeypox was found in 1970 at Democratic Republic of Congo. The disease of monkeypox remained as an endemic in Nigeria for many years, but in 2022, on May 6, it was announced as an outbreak as it has spread to several countries in the world. Now we will see the definition of monkeypox. Mpox or monkeypox is an infectious disease caused by the monkeypox virus. It can cause a painful rash, enlarged lymph nodes, and fever. The definition was given by World Health Organization. The short form for monkeypox is given as Mpox by WHO. Here we can see this person infected with monkeypox virus, and we can see the manifestation of monkeypox virus. This is the monkeypox rash, and it is in starting stage called macular stage. We will see about the stages of monkeypox in further slides. There are two different clades of monkeypox virus. The first one is Congo Basin clade, that is Central African, and the West African clade. So the Congo Basin clade is more reported than the West African clade. This is more frequently seen. Now coming to the epidemiology of monkeypox. Epidemiology. Epidemiology means epi means upon, demos means people, and logos means study. So we will see in epidemiology, we will study how the disease is spreading among the people, how it is existing among the people, or how common is the disease among a particular population. In 2003, 53 human cases of monkeypox were reported. In October 2018, one case occurred in a man who traveled from Nigeria to Israel. In May 2019, one case occurred in a man who traveled from Nigeria to Singapore. Here we can see the disease is existing as endemic in Nigeria. This is the worldwide scenario. In May 2021, a family returned to the United Kingdom after traveling to Nigeria, and 3 family members became infected with the monkeypox virus. In July 2021, one case occurred in a man who traveled from Nigeria to Texas. In November 2021, one case occurred in a man who traveled from Nigeria to Maryland. So coming to the India, the first monkeypox case in India was reported on July 14th, 2022. The first case in India was reported on July 14th, 2022. Here we can see the number of monkeypox cases worldwide in different countries. These color shades are given according to the number of monkeypox cases in each country. The dark purple was given to United States of America, Alaska, and United Kingdom, where we can see the highest number of monkeypox cases. The next is 3,000 cases, and in India it is less than 50 cases. In India and Asian countries it is less than 50 cases. Next, we will see the incidence of monkeypox. The incidence represents the number of cases at a given time in a given population. The number of cases of a particular disease in given time in among the given population. Incidence in 2022. First, we will see the global incidence, that is worldwide incidence. As of 18th March 2023, there had been a total of 86,516 confirmed cases in over 113 countries. So in 113 countries, we saw these monkeypox cases, and the total confirmed cases in the whole world as of 18th March 2023 are 86,516 cases. And the highest number of cases we can see in United States of America, that is 30,505 cases. Then the incidence in India is 22 cases. We can see total of 22 confirmed cases in the whole country. This is according to the information from Center for Disease Control website. Public Health Emergency of International Concern, PHEIC. What is this public health emergency of international concern? It is a state of emergency. So on July 23rd, 2022, World Health Organization, that is WHO, Director General Tedros Adhanom Ghebreyesus, PhD, declared the current monkeypox outbreak a public health emergency of international concern. Since these cases were increasing rapidly into several countries, it was declared as outbreak, and then immediately it was considered as a public health emergency of international concern by the World Health Organization Director General. Raising awareness of risk factors and educating people, health professionals, and nursing students about the measures they can take to prevent the exposure to the virus. And this is the main strategy to prevent the outbreak and also prevent the pandemic. Here we can see the picture of the Director General of World Health Organization, Dr. Tedros Adhanom Ghebreyesus. Next, coming to the modes of transmission of monkeypox disease. How and what are the modes for transmitting this virus from person to person or from animal to a human? Here we can see a case of monkeypox in a child. We can here witness this rash. They are pus-filled blister-like structures, and they are deeply seated inside the dermis of the skin. These are the modes of transmission: monkeypox rash and scabs, saliva, upper respiratory secretions, and areas around the anus, rectum, or vagina, oral, anal, or vaginal sex, or touching the genitals like penis, testicles, labia, and vagina, or anus of a person with monkeypox, hugging, massage, and kissing, prolonged face to face contact. These are some of the modes of transmission. The first and foremost important transmission is occurring through direct contact with the person who is infected with monkeypox. Next one is through sexual transmission, and especially homosexuals are at high risk for transmission of this disease. Pregnancy and perinatal period. The monkeypox disease from the mother to the fetus can be transmitted, and also during the perinatal period while giving birth or during the postpartum stage. There is high risk for the baby to get affected by the monkeypox uh, by the mother if the baby is not isolated or separated from the mother. This is while giving birth. As a nurse and healthcare professional, we should be aware of uh, isolating the baby from the mother. Next is through infected animals. So a scratch from the infected animal or a bite can transmit this virus from the animal to humans. Next, coming to the pathophysiology of monkeypox disease. First step here we can see is exposure. It may be through animal exposure or through the human exposure, through skin lesions, oral secretions, respiratory droplets, or sexual body fluids. Then after the exposure, viral replication at the portal of entry will take place, and then the lymphatic spread occurs. As soon as the antigen entry into our antibody, the white blood cells, the scavenger cells are the one who responds first. So there will be lymphatic spread, which again leads to regional and distant lymph nodes. And at the same time, we can see primary viremia, and in this, spleen and other lymphoid organs are affected. Then it will lead to the secondary viremia, and finally the target organ seeding takes place like in organs like eye, skin, liver, digestive system, and brain. So here the incubation period may be from 5 to 21 days, and the prodrome phase where we can see symptoms is from 1 to 5 days. Here we can see flow chart of the pathophysiology of monkeypox disease. Viral entry from any route, that is oropharynx, nasopharynx, or intradermal. Monkeypox virus replicates at the inoculation site and then spreads to local lymph nodes. Initial viremia leads to viral spread and the seeding of other organs. This represents the incubation period, typically lasting from 5 to 21 days. Symptom onset correlates with a secondary viremia, leading to 1 to 2 days of prodromal symptoms such as fever and lymphadenopathy before lesions appear. So before we can see the lesions, first we can see the fever and lymphadenopathy. Lesions start in the oropharynx and then appear on the skin. So first we can see the lesions in the oropharynx, that is the mucous membrane in the oral space. Then the serum antibodies are often detectable by the time lesions appear. Signs and symptoms of monkeypox disease. First, we can see the rash. It is a distinctive rash. Here we can see a rash which goes through 5 stages. The first one is macules. Here we can see the reddish spot-like structures. Then we can see papules. This reddish spots are swollen and they are slowly raising above the surface level of the skin. The third stage is vesicles. These structures are now filled with the fluid and also surrounded by reddish discoloration of the skin. Next stage is pustules. So this fluid-filled vesicles are now filled with pus, and these are deeply seated inside the skin. Stage 5 is the final stage. All these blisters are developing into scabs, and finally they fall off. The pus-filled blisters scab over and fall off in 2 to 4 weeks. Big signs and symptoms we can see is fever with chills, respiratory symptoms like cold, cough, and throat pain, swollen lymph nodes, exhaustion, headache, backache. These are all the signs and symptoms of monkeypox disease. Next we will see the diagnostic evaluation. The diagnostic evaluation, first we have to take the history from the patient and then we have to go for physical examination. In history taking, we have to ask the patient about the symptoms onset, from when is the prodromal symptoms like fever, throat pain, or any other symptoms patient is facing. And also we have to ask the patient about the medical conditions like any allergies or other chronic diseases if the patient is suffering with. Then comes the physical examination. We have to observe the patient for rash or lesions and possibly lymphadenopathy. We have to observe the rash of the patient and we have to see the characteristics of the rash, how deeply it is rooted, or whether it is a vesicle or in macular stage, or whether it is in pustule stage. Perform a thorough skin and mucosal examination, that is anal, vaginal, oral, nasal, and ophthalmic. So in these areas we can see the mucosa and we have to observe for the vesicles or rash on these areas. It starts on the face and body and then spreads centrifugally to the palms and soles. The characteristics feature of this rash is it starts on the face and body and then spreads to the palms and soles. That is from periphery, that is central to the periphery. The rash is 5 to 10 millimeters in diameter. It is discrete or confluent. Vesicles are well circumscribed and are deeply seated in the dermis layer of the skin. So here the next point is the rash usually resolves over a period of 2 to 4 weeks. Here we have to remember that rash can resolve from 2 to 4 weeks if it is not infected with any other bacteria or any super infection. So it is very important that we take care of the rash, that it should not be disinfected. In the 2023 22 to 23 global outbreak, the presentation has been atypical, with the rash presenting primarily in the anogenital region. So we all know that in 2022 to 23 global outbreak has been occurred. So when the outbreak has occurred, it is observed that the rash was very common in the anogenital region during this season. Next one is PCR test is used for monkeypox virus detection. And also one more test, nucleic acid amplification testing, NAAT. The short form is NAAT, nucleic acid amplification testing. So these are the tests which are used to confirm the monkeypox virus. Next, we will see what are some of the abnormalities we can see in the laboratory investigations for a patient with monkeypox. Elevated hepatic transaminases. We can see elevated hepatic transaminases and low blood urea nitrogen. The BUN levels, BUN levels will be lower than the normal, and hypoalbuminemia. The level of albumin in the blood is lower than the normal range. Next one is leukocytosis, increased level of WBCs in the blood. We can see the symptom in any kind of infection since our body is fighting with those antigens or any foreign body. Here we can see the antigen is monkeypox virus. So our body is trying to fight with that. Hence there is increase in the number of white blood cells. White blood cells are the scavenger cells. They are like protection to our body. They are the immunity to our body. Next one is thrombocytopenia. The thrombocytes are nothing but platelets. So there is decreased level of platelets inside the blood. Next, we will go to the complications. What are the complications of monkeypox? This is very important because the disease monkeypox if it is not managed properly, it may lead to complications, and these complications may lead to death. Even though virus may be overcome by the host, that is nothing but infected person, these complications, if they are uncontrolled, it may lead to death. The first one is dehydration. It may sound simple, but it is very important to take care of this dehydration. If it is not taken care of, it is very, very dangerous and it may lead to death. Dehydration may occur due to vomiting, diarrhea, decreased oral intake, due to painful oral lesions, and insensible fluid loss from widespread skin disruption. So there is widespread rashes everywhere. So there is pus in all those rashes. So by that there may be insensible fluid loss from the body, and also due to the oral lesions, they are painful. Patient may not take food and fluids properly. It may lead to dehydration. Next complication is pneumonia. We can see the respiratory symptoms in the monkeypox disease. As we saw in signs and symptoms, there are respiratory symptoms like throat pain, cough, and also cold. So this may, if that is not taken care of, it may lead to pneumonia. That is nothing but fluid in the lungs. Here we can see how the alveoli are filled with fluid. Hence there is little space for the air to enter for the gaseous exchange. This is the healthy alveoli. This is the alveoli filled with fluid. The lungs may appear like this. Hence we can see the difficulty in breathing. Permanent skin scarring. So since these those pustules are deeply seated inside the dermis, after healing it may lead to permanent skin scarring. So hence the dermatological care should also be given to the patient appropriately to reduce this risk of scarring, permanent scarring. Next one, this is very important because this may lead to the complete necrosis of the tissue, bacterial superinfection of skin. So after rash has occurred, if those rashes sometimes they may break out, and there may be open wounds. If those wounds are not taken care of properly with the aseptic techniques, it may lead to super infection. Means other bacterial or other viral fungal infections may infect those pustules, that skin, and it may lead to super infection. Next one is permanent corneal scarring and vision loss. So as we saw in the beginning, this rash may occur even in the mucosal layers, like in eye, vagina, anus, and nasal cavity. So this rashes may occur even on those mucous membranes, and if it is occurring in the eye, if proper care is not taken, proper treatment is not given, it may lead to the permanent corneal scarring, which may lead to vision loss. And some other complications are sepsis, that is infection in the blood, and encephalitis, inflammation of the layers of the brain, and death, obviously, finally, if those complications are uncontrollable, and hyperpigmentation or hypopigmentation of the skin. So these complications are seeming very dangerous than the actual disease. So hence it is, as a healthcare professionals, we have to take 100% measures to prevent these complications for our patients. So here we can see the infected case of monkeypox. Monkeypox rash has occurred, but this rash has been infected with some other bacterial or fungal infections, and it became uncontrollable. And here we can see how the skin is completely cut off from the blood supply, and it is necrosed. The tissue death has been occurred on the face. Here we can see the swelling, the pus, and the complete damage of the skin, and even the eyes are closed. Here the patient is not able to see even. Here we can see the necrosis, and complete tissue damage and destruction has happened. Here the uh, pus and the infection, we can see the like in the, these are the stages how the patient has been infected severely. This is one of the severe case of monkeypox. For in some cases, the virus may infect severely, and we can see the rash is very severe in this case. These are the pustules. You can see the pustules in the mucous membranes also very clearly. Next, we will go to the treatment or management. The first step here is there is no particular proper cure for this disease, but some drugs are being used to treat these cases. First one is symptomatic treatment. As in any other disease, we will be giving the symptomatic treatment. That is, if the patient is suffering with fever, the antipyretics are given, and for fluid management, we are giving IV fluids and oral fluids, and for painkillers if any pain exists, and dermatological care for the rash and pustules. So that comes under symptomatic treatment. Next one is the oral DNA polymerase inhibitor, that is brincidofovir. So this is one of the drugs. These are the oral drugs. These two drugs are very are um, are seen to be very effective in treating this disease. Brincidofovir and tecovirimat. The tecovirimat is oral intracellular viral release inhibitor. So it inhibits the viral release inside the cells. Next one is intravenous vaccinia immunoglobulin, and this has unknown efficacy against the monkeypox virus, but they are considering this intravenous drug also, and they are thinking it may be effective against the monkeypox virus. Still, research has to be done. Next one is dual therapy with tecovirimat and brincidofovir, and in some severe cases, they are trying like giving both the drugs at a time for severe cases. That is called dual therapy. The age group from 25 to 30 years does not require much hospital treatment. Here we can see, like in maximum cases, it was observed that this age group, like we can treat them at with home management, like with little bit with the lesser suggestions. But the age group above 35 years may need to have closer observation and much nearer hospital treatment. Here we can see the action of brincidofovir. This drug has one lipid chain, and it crosses the cell membrane. After crossing the cell membrane, that lipid chain is broken down and it goes to the virus, and it prevents the viral replication. Here we can see the virus, it is stopping the virus from replicating. Next, coming to the nursing management, it is very important for us as nurses. We have to know what is our role in taking care of these patients. First point we have to remember in any communicable disease, and especially in monkeypox, patient isolation and protection of compromised skin and mucous membranes. So the patient suffering with the disease need to be isolated, and the caregivers must be completely protected with personal protective equipment. And also the rash of the patient should not be exposed to everything. They are to be covered with clean and loose cotton clothes. Next one is rehydration. So we all know what is the complication of dehydration. So because since the patient may be suffering with fever or vomiting or diarrhea, or patient may be having insensible fluid loss through the rashes, all those pustules, or patient may not be taking enough oral fluids, like may not be able to take the oral fluids because of the pain due to the rashes inside the mouth. Hence, it is very important, as per the need of the patient, we should encourage the plenty of oral fluids, or we can administer intravenous fluids as prescribed by the physician. Next one is nutritional support. As a nurse, we have to keep an eye on the nutritional status of the patient, as the nutritional status plays an important role in the recovery of the patient and also helps the patient in fighting the virus. We have to encourage the patient for healthy diet and provide some provisions and encouragement to the family members and caregivers to provide the nutritious diet, healthy diet to the patient. If the patient is not able to take orally, we may have to provide those intravenously as per the prescription of the doctors. Next one is vital signs. The vital signs are temperature, pulse rate, respiration, and blood pressure. These are the things which give a lot of information about the patient's status and condition in which the patient is. Through by observing the temperature, we can know whether the patient is suffering with fever, and we can know the viral action inside the body of the patient. And the pulse rate, it can give us information about the hydrational status and the patient's condition. Respiratory rate may give us the information about any pneumonia patient has, or any difficulty breathing, etc. Blood pressure, so it also gives the patient's hydrational status and also the condition. If the patient has any weakness, or if the patient is suffering with chronic blood pressure, we have to check these signs give a lot of information about the patient's condition to have to go through further treatment. Next, coming to the personal protective equipment like mask. Patients should also be using a triple layered mask along with the caregivers, and the rash should be covered as much as possible by clean soft cotton cloths. Next one we will see is prevention. Prevention is very important aspect in communicable diseases, and as healthcare professionals we have to be aware of the preventive measures, and also we have to make people aware of the preventive measures, because it is always better than the cure. So the first point in prevention we have to remember is avoid close contact with people who have a rash that looks like monkeypox. So immediately after the rash, we may take time to confirm it as monkeypox. So we have to avoid those people, direct contact with such people. Like we have to be informative, and we have to communicate that with the patient in a positive way. We should not be like eliminating the patient or isolating the patient completely physically, emotionally, and mentally, but we have to isolate the patient in a respectable manner and with a positive attitude. It is not that we are isolating the patient completely as a being, but we are isolating the patient just for the protection of the patient and others. Next point is avoid handling clothes, sheets, blankets, or other materials that have been in contact with an infected animal or person. So, as we all know, this disease can spread through respiratory droplets, mucous membranes, the scabs of the rash, and also the fluid from the rash. If that is transmitted to the other person, this virus may easily spread. And also there is a sexual transmission, and also the sexual transmission in the homosexuals, so it is very communicable. Hence we have to avoid those clothes, sheets, and blankets, other materials that have been in contact with an infected person or animal. Next one is isolate people who have monkeypox from healthy people. So as we already saw in the nursing, as we already saw in the nursing management, so it is very important that we should isolate the people who have this disease so that it may not spread to the other people and may not become an outbreak. Next point is wash your hands well with soap and water after any contact with an infected person or animal. As healthcare providers and nurses, we come in contact with all those patients. Like it is inevitable for us to avoid these patients. So we have to go to those patients with all the personal protective equipment. It is not only for our own protection, but it is for the protection of others outside in the community and also our own families. Avoid animals that may carry the virus. If you suspect any animals to have this virus, we have to avoid those animals. Especially in monkeys, we can usually see this virus. Here we can see the monkey with a monkeypox virus infection. Next one is vaccine. So here, who need to be vaccinated? Here, the CDC, Central for Disease Control, has recommended that only the healthcare providers and the most exposed persons may be vaccinated. But at this time, all the members need not be vaccinated. Like in COVID-19, we all got vaccinated, 3 doses, booster dose. But in this case, the CDC is not recommending that for vaccination for everyone, but for only the people who are being exposed to that disease, like healthcare providers or any lab technicians, etc. And here some smallpox vaccines can prevent monkeypox. It is proved clinically, including the ACAM 2000 and Jynneos vaccine. So these two vaccines are the smallpox vaccines. Since the monkeypox virus is of the same family of smallpox, this vaccine is proved to be effective for the monkeypox disease, for prevention of monkeypox disease. So these are the vaccines used in prevention of monkeypox. Some people who are at risk of being exposed to the virus in their work, such as lab workers, may get vaccinated. The Center for Disease Control doesn't recommend that everyone get vaccinated against monkeypox at this time. Now we will briefly summarize the whole topic. Some of the points need to be remembered are monkeypox virus is an enveloped double-stranded DNA virus. It belongs to the genus called Orthopox virus genus and family called Poxviridae family, that is the similar family to which the smallpox virus belongs. It was discovered in 1958. The first human monkeypox case was found in 1960. 1970 in Democratic Republic of Congo. And the the virus of monkeypox was detected in Denmark in 1958. The first case was found in India on July 14th, 2022. In India, we found the first human case on July 14th, 2022. PHEIC, that is Public Health Emergency of International Concern, was announced by WHO on July 23rd, 2022. This was announced due to the monkeypox outbreak on July 2022, July 23. And the main modes of transmission of this virus are through direct contact with an infected person, sexual transmission with an infected person, pregnancy and perinatal period, and also with infected animals. Here we will see the pathophysiology. We can see it briefly. After the exposure to the virus through other humans of skin lesions, oral secretions, respiratory droplets or sexual body fluids, or through animal exposure by bites, scratches or skinning consumption. And after exposure, the viral replication at the portal of entry will take place. After that, lymphatic spread occurs. Regional and distant lymph nodes are also affected. Then primary viremia, we can see primary viremia, that is spleen and other lymphoid organs are affected. Here in this phase, we can see the incubation period, that is 5 to 21 days. In the prodrome phase, we can see the symptoms outside. It is manifested outside. It is the duration of prodrome phase is 1 to 5 days. In this stage, we can see the secondary viremia. After that, we can see the target organ seeding, that is in the eye, skin, and also digestive system and brain. The signs and symptoms are rash, that is distinctive rash. We all know they are 5 to 10 millimeters in diameter and they are deeply seated inside the dermis. Swollen lymph nodes, fever, respiratory symptoms, exhaustion, headache, backache. These are some of the signs and symptoms of monkeypox. Diagnostic evaluation, mainly we have to do the history taking, physical examination, nucleic acid amplification testing, and also we will do the PCR testing for MPXV, that is nothing but monkeypox virus. Complications are dehydration, permanent skin scarring, bacterial superinfection, pneumonia, sepsis and encephalitis, permanent corneal scarring. The treatment is given with two main drugs presently and also the symptomatic treatment. The two main drugs are brincidofovir and tecovirimat. Brincidofovir and tecovirimat. Nursing management, patient isolation and protection of compromised skin and mucous membranes. That is, we have to isolate the patient and also we have to protect the compromised skin and mucous membranes. Wherever the rash is present on the skin and mucous membranes, we have to protect those. We have to prevent, we have to discourage the patient for scratching. We have to tell the patient not to scratch those rashes, and also we have to protect the skin with rash by covering them with clean cotton and loose cloths. Then rehydration, nutritional support, vital signs, personal protective equipment. Then prevention, avoid close contact with people who have a rash that looks like monkeypox. Avoid handling clothes, sheets, blankets or other materials that have been in contact with an infected animal or person. Wash your hands well with soap and water after any contact with an infected person or animal. Isolate people who have monkeypox from healthy people. Avoid animals that may carry the virus. So these are the main important points we have to remember. Hand washing technique, we all know it is very important for any type of disease. Next, conclusion. I would like to conclude this session by telling that though the fatality rate of this monkeypox disease is very less, but the complication caused due to this disease may lead to death, and they are very severe. Hence, it is very important for us to know about this disease as nurses and nursing students, and also for all the healthcare professionals, and be ready to face this kind of diseases and prevent the outbreaks. Or we can even, if we know and if we are prepared, we can even prevent the pandemics. Thank you everyone for listening patiently.